So I'm pleased to report that it does not appear that easing measures has caused an uptick in numbers since we entered Step 1 on February the 8th. We continue to see a decline or plateau in both our lagging and leading indicators. There's been some variation in the positivity rate for PCR tests, but overall, since Step 1 began, it has dropped by 7%. There has also been a continuing steady decline in the most important lagging indicator, hospitalizations. Today, hospitalizations are down to 989, including 70 in ICU. Both those figures are down by around 40% from when we began easing measures. It will take time for hospitalizations to get down to the level before the fifth wave, but this is promising news for the health system. Alberta is going through a period of transition. As we shift out of crisis mode and move toward an endemic response, we can make adjustments to the way we operate, which is why I would like to announce 2 changes that we are making to our COVID-19 response. First, we are modifying our public data reporting. Beginning next week, we'll join other provinces, such as Saskatchewan, in reducing case and outbreak reporting to once per week. Data for the previous 7 days will be available each Wednesday. With this shift, we'll also consolidate some of the data posted to alberta.ca to reflect the most relevant current information. For example, as contact tracing currently is being done only in high-risk settings, we're removing the source of exposure graph that lists most cases as being from an unknown source. I know this will be adjustment for some Albertans who have become used to checking the website on a daily basis.
There are currently 989 people with COVID-19 in hospital, including 70 in the ICU. From the beginning of the pandemic, I have been committed to ensuring Albertans have had access to timely and accurate information about COVID-19. That priority remains today, 2 years later, and as we find ourselves in a very different situation than when COVID first arrived in Alberta. That is why I believe that modifying our public reporting to once a week, as the Minister just announced, is the right thing to do. Our most recent review has found that there are 16 previously reported deaths between December 21st and February 11th that did not have COVID-19 as a contributing cause. 38 other deaths reported in this time frame were also reviewed, and in those cases it was confirmed that COVID was a direct or contributing cause of death. This means that with the 4 new deaths that we have had reported to us in the last 24 hours, the total number of deaths in Alberta related to COVID-19 will be updated today to 4,013 deaths, a net decrease of 12. One of the things that we're looking at is the fact that as we go forward, COVID-19 will be one of likely several respiratory viruses that we need to be tracking and monitoring. So one of the things that we're looking at is an ability to regularly report on respiratory viruses and the picture of what that looks like in the province, because again, it's the collective impact of all of the circulating viruses that will be important for our public health system and our acute care system. So that is something historically we have always, during influenza season, reported at least weekly on our influenza updates. And so at a minimum, that kind of reporting, so the public is aware of what is circulating, is what we're looking at. And then, as the Minister mentioned, adjusting that if needed, depending on what the situation is at any given moment in time.